Well, the Red Cross chief says the Ebola outbreak that has killed more than 4,500 people in West Africa could be contained within 4 to 6 months if the right steps are followed. Alhaj Asai told reporters Wednesday in China the time frame is possible with good isolation and treatment for those with confirmed cases of Ebola, along with proper burials for those who died from the virus. Tsai also insisted that imposing a travel ban on people from the hardest hit African countries will not effectively curb the outbreak.
So it creates a lot of fear and extreme panic that sometimes, does lead to very irrational, type of behaviors and measures like closing borders, cancelling flights, isolating countries, etc. And those are no solutions. The only solution is how can we join our efforts to contain those kind of viruses and epidemic at their epicenter, right where it starts, to contain it there.
Well, meanwhile, the World Health Organization is convening a meeting of its Emergency Committee on Ebola to discuss the latest developments in the outbreak and whether to alter its recommendations. While tens of thousands of people in West Africa are expected to begin receiving experimental Ebola vaccines in January, but mass immunizations is still far off. The WHO says the clinical trials of the GlaxoSmithKline and New Link Genetics vaccines are underway, with 500 volunteers set to participate in the US, Britain, Germany, Switzerland, Mali, Gabon, and Kenya. Dr. Mary Pauli Kaney, WHO Assistant Director General for Health Systems and Innovations, says the test will generate data on safety and protection in December before the vaccines can be rolled out early next year.
There is still a possibility that will fail, but everybody is putting things in order for being able to move to West Africa in January. So this will most likely be in the form of efficacy trials, but in order to have a response as quickly as possible, these trials will need to be quite large and enroll quite quickly.
While the GSK and the New Link vaccines are considered lead candidates, there are also other vaccines being developed.